Okay, we'll go ahead and call the meeting to order. The Jackson County Board of Commissioners. Today is our work session, November the 10th, 2020. Welcome everyone here to the Department on Aging, the Heritage Room. And at this time, I'm going to recognize our County Manager, Mr. Adams, to go ahead and facilitate the meeting.
Yes, sir. First item we have discussion. We do have Shelley Caraway, our Health Director here. We got a couple items that we have on the list here. One is I've asked Ms. Caraway, the Health Director, to come and just give an update to the board in regards to COVID-19. And then obviously the second item is to discuss a Board of Health resolution that has been passed here recently by the Board of Health. So having said that, I'll just turn it over to Ms. Caraway.
Thank you so much and good afternoon to all. Can you hear me?
Shelley?
Can you hear me?
She has to unmute herself, doesn't she? She's unmuted.
Shelley, can you hear us?
Oh.
I can hear you. Can you hear me?
Shelley, can you hear us?
I can, but nobody seems to hear me. Hello?
Shelley, I can hear you.
Oh, that's weird. Can they hear you?
I'm not sure. Can anyone hear me? This is Melissa from the Health Department.
I can hear her as well, Melissa. This is Beth from the Silver Herald.
Hi.
Hi.
Hi. I could just give you my update.
I can hear too, so that works.
Hi, Holly.
Hey.
Shelley, if you can hear us, we're having problems on this end hearing you, so give us a minute.
Shelley, can you hear us now?
I can always hear you, but can you hear me?
Yes,
Yeah.
we can hear you now.
Hooray! Technology at its finest. Well, thank you for allowing me to speak and good afternoon to all. And I apologize up front. I do have a little bit to say and I may talk fast, but I just do want to cover an update on both COVID-19 and this vaccine that's coming our way. So the update on COVID-19 is both good and bad. It's always been evolving, but it is now coming at us fast. First, the bad news. I'm sure you've all seen the spike in cases in Jackson County, North Carolina, and quite frankly, the nation. And I'm not going to present the statistics. I hope all of you follow the many sources that are out there, including our health department website. But I did want to point out a couple of alarming facts that may stick with you. So to start with the big picture, back in October, I reported to our Board of Health that COVID-19 had become the third leading cause of death in the nation behind #1 heart disease and #2 cancer. But to date now, COVID-19 recently surpassed heart disease and is now the leading cause of death in the United States. I'd also like to share something that kind of puts it in perspective a little closer to home. North Carolina recently hit the death toll of over 5,000 deaths due to COVID-19 in only 10 to 11 months. Comparatively, to make it stick, there were a total of 1,500 deaths due to flu over the past 10 years. So this is nothing to fool with, and it's not just the flu. I think you already know that. But in our state, we've also been hitting more devastating milestones. For example, in the last week, our case count broke records on 3 days. We've had more than 6,000 new cases per day on 2 of those 3 record breakings. And just last month, we were startled by over 3,000 cases. So, and I do think you probably already know this too, but very recently, the state put out a new tool that was called the County Alert System, and it uses metrics to categorize all of our counties into tiers from least to worst, yellow, orange, and then red as worst. And the primary metric is the case count in that county. And then you determine the tier you fall in, you have to meet a threshold of either the impact on the local hospital or the % of tests that are positive. And the newest county alert map shows for our state that almost half of our counties, 48 out of the 100, are in the red zone, the worst. And in the orange zone, we have 34. So that means that over 80% of our counties are in red and orange. And now, of course, closer to home, talking about Jackson County, unfortunately, we are following the trends as well. 2 weeks ago on the county alert system, we were in the yellow. This week's new report shows us pretty much joining that majority. We even skipped the orange and went right to the red. Now, we can attribute this to a couple of things. We have had 2 additional outbreaks in long-term care facilities, and we already had one, and that added large numbers to our case count. But I don't want to just dismiss it on that, because we've also seen a spike in our community, most likely due to Thanksgiving events that are still coming in. And while we are still in the midst of our investigations, it really feels like our rise in cases is due to family and social gatherings. I know we're all tired of the precautions, and it's really easy to get comfortable and let your guard down around people you love or you know well. But it is important to point out that now is not the time for that. And I want to point out that our red status is due to the case rate and the percentage of positive cases to total tests. So the good news is our hospital's still doing okay. I speak to the hospital at least 3 times per week, and even though they are currently seeing high capacity in census and in the ICU, it's not an alarming number yet. It is on par pretty much with what they normally see this time of year. But more good news is that we're not seeing flu as we had feared. I guess all that hand washing and wearing masks works. So right now they'd normally be seeing a lot of flu, but that has not been the case. So right now our hospital's it's okay. But so what can we do in Jackson County? You can see that the governor's trying very hard not to impose more restrictions, partially for the sake of our economy. And I tend to agree with that at this point. We should not have to mandate our way out of this. I mean, early on, none of us really knew what to do, and we got conflicting advice on masks and things. And of course, public health's been preaching hand washing for decades for lots of disease prevention, including the flu, and many people are ignoring that. But now, as we've gone on in this pandemic, we've learned so much more and really proven so much more. And the science is truly growing that face coverings really do help, especially when combined with maintaining that 6-foot distance from others, and of course, still having the great hand hygiene. But so having said that, I would also like to say that when I look around Jackson County, I am pleasantly surprised at how many folks are wearing masks in public. And I know there are some that do not and probably never will. And we also do know of some establishments that do not enforce it or even have their own employees wearing masks. But overall, we seem to be doing well in that regard while we're in public. And we do get complaints and tell folks that see others that are disregarding the mask order, just stay away from those people. And if it's a business that's not complying, we just tell them, don't go to those establishments. But from our contact tracing, what we're realizing is really an increasing problem is that families are getting together more, friends are getting together more, social events are happening. And in those settings, it just seems okay to let your guard down and your mask down and to hug and to shake hands. And again, I hate to say it, but now is the worst possible time to do that. Speaking of the contact tracing, which is one of our major tools, I'd like to take this opportunity to send a plea out to please answer the phone and please share your close contacts when we call. They've recently changed the quarantine requirements, and so they can sometimes be shorter than that 14 days we had at the beginning. In part, they did that to help increase compliance. I mean, we feel like now people are fearing quarantine more than being worried about the virus because they have to miss work and stay away from family. And then they don't want to give us names of close contacts because it feels like they're betraying their friends and family. But without this tool, spread's inevitable. I mean, especially with the fact that we now see close to 50% of our cases being asymptomatic. So you don't even know you have it and are spreading it. But the other thing I wanted to kind of spread the word about with coronavirus, including the one that causes the common cold, it peaks in the winter months, peaks, so it goes up. That's just like the flu. And that's just simple science because it's due to temperature and humidity levels. The particles that we expel that they've all talked about that spread this stuff when you're talking and breathing do not travel as efficiently in warm, moist summer air as they do in this dry, cold winter air. And then you compound that with the fact that the cold weather and of course now our holiday celebrations are driving us indoors where air recirculates. And that too is an increase in risk of transmission. So those are the things I just wanted to bring forward. And this year, of course, it's a year like none of us have ever experienced and hope we never do again. But as we see this resurgence in new COVID-19 cases, it's just critical that we keep working hard to take all the precautions we can and that we know work. I know we're all tired of it, but we know what we need to do during this pandemic, and it's not just one thing. It's the list. You know the list. Wash your hands, wear a mask, physically distance from others, and to the best of our abilities, participate in contact tracing, testing, quarantining, isolating. And I would say avoid indoor spaces with people that you're not related with, that you don't live with, unless it's essential. Postpone that travel, enhance ventilation if you can, even though I know it's cold. I mean, we all need to think about protecting our families and ourselves and our community. And then last but not least, coming soon, we'll want to achieve that widespread vaccination coverage once we have that vaccine. So speaking of the vaccine, I'm sure you want to know more about what is coming there. And maybe you know as much as I do. And I'll tell you what I know. It changes literally every hour, but it is very good news. We are very close to having vaccines in this county. And they appear to be very effective, more effective than we thought, and safe. So today, the Food and Drug Administration and then the Independent Advisory Committee are reviewing Pfizer. And a week from today, Moderna will be reviewed. And we expect that shortly after those meetings, the FDA will get them to the public through the emergency use authorization, as long as they are truly found to be safe and effective. But we really predict that's going to happen. And I know there have been concerns raised about how fast these were developed. And it was quick, but the process was followed. It was just expedited. Scientists had a head start pretty much due to the fact that vaccine development has been evolving for many years for similar viruses such as SARS. So they kind of had a heads up. And a lot of money was invested to allow thorough clinical trials to go forward and also to ensure that they could manufacture millions of doses at the same time. Funding goes a long way. So that's what allowed the scientific community to shorten the time to get us to the vaccine, not cutting corners. And I know there's some people have concern about what's in the vaccine. I don't have that whole list yet, but we've been assured that there aren't preservatives. And of course, it's important to know that there is no live COVID-19 virus in these vaccines. What they do is they simply imitate the virus to trigger our bodies into thinking that they have a virus to fight off. And that causes our bodies to create that antibody defense we need to fight off COVID if and when that bad guy shows up. So, and I did want to mention another interesting fact. We've gone from one major vaccine candidate to three, and all of them, AstraZeneca, Moderna, and Pfizer. It's really crazy. They got to be stored at different temperatures. They all have different minimum orders. They all do require 2 doses, though not on the same schedule. So it's really making everything a bit more complicated on our end. And I have heard there's a 4th and possibly a 5th vaccine manufacturer that's close to being on the scene as well. But I don't know a lot about them, but that still is great news that it's coming and it's coming fast. And we should all be happy about that. And health departments and hospitals were the first to be eligible to sign up to be the COVID-19 vaccine providers. There's a lot you have to go through and say. And they recently started adding FQHCs, but eventually the community healthcare providers, our local docs, will also be able to enroll as providers. And you may have heard there is vaccine coming next week, and that's exactly what we're expecting if it's authorized. It will be initially a very limited supply. To be specific, North Carolina is getting 85,800 doses of that Pfizer vaccine in next week, literally next week, if all goes as predicted. That's not enough vaccine in our week 1 allocation to send to all hospitals. So 53 hospitals have been identified and they've already been notified they will be receiving them. I have the list if anybody's interested. The initial distribution was based on the size of the hospital using numbers of acute and ICU beds. So Harris Hospital will not receive any of that first week's doses. However, in week 2, the week of the 21st, Christmas week, there's supposed to be a shipment of Pfizer and Moderna. We should receive, what we've been told today was 175,900 of Moderna and the same 85,800 or possibly a little more of Pfizer. So by week 2, it's been stated to us that all hospitals and local health departments should receive some vaccine in week 2. And those week 2 allocations are based on population, so I have no idea how much we're going to get. But going forward, the good news is the vaccine is anticipated to be delivered every week. And on top of that, North Carolina developed a vaccine distribution prioritization framework. And basically it just sets up who's to receive the vaccine and in what order. There's actually 4 phases that it lays out. And that limited initial supply, especially week 1, is set to go to healthcare workers at high risk of exposure to COVID-19. That includes those that are caring for COVID patients, like in the hospital. It also, though, includes anybody cleaning areas that are used by those patients. Also on the list are those handling decedents with COVID, or of course us that are going to be doing closed and targeted vaccination clinics. All staff involved in those clinics are under that realm. So even once all the hospitals and health departments receive vaccine in that second week, the focus is going to continue to be on vaccinating those high-risk healthcare workers. Now, you've probably heard too, long-term care staff and residents will also be in the first group to receive the vaccine. Now, that initiative is being handled by the federal government in partnership with large drugstores like CVS and Walgreens, but those vaccine numbers will still come from our state's allotment. So that's due to start in week 2. We really hope that by early 2021, health departments and community healthcare providers will start vaccinating other adults. And it's going to start first with those who are at high risk for complications, which really kind of means you have 2 or more chronic conditions, or if you're at a high risk for exposure, essential workers, basically. And I will add that children will not initially receive vaccines because the clinical trials with those children are still needed, and they just started those trials. So it'll be a minute before kids can get it. So that's all exciting news and should give us hope, but I still want everybody to know it's not a quick fix. It's going to take several months for us to have enough supplies for anyone who wants to get it. And remember, these vaccines require 2 doses, so we will not be out of those till possibly late summer. So again, even though it's so hopeful, we don't pin all of our hopes on the vaccine. We still should plan on having face masks in our lives for a while. We should do all we can to continue to slow the spread of this virus and save lives. And we really want to avoid possible increased restrictions and closures, but we really should plan on the possibility of them coming. I hate to be a broken record, but I'd like to say, as I've said all along with this pandemic, act like you have it and that you're contagious, and keep that in mind as you make personal decisions. And just continue to do all the things we've all worked on knowing how to do, and accept the probability the vaccine's going to take a little time to get distributed. So I know I talked a lot and I talked fast, but before I stop, I would also like to take a quick opportunity, since I'm before you today, to talk just a minute about our health department. We are overwhelmed. From the beginning, it was a tough learning curve about everything COVID, but we also carry that burden of case investigation and contact tracing like we always do in communicable diseases. And now we have the added burden of mass vaccination. And by the way, during all this, we still have to carry on our mandated services that we were already doing. We have a few people that have been working 7 days a week for a while. And it's important to remember that we only have 5 nursing positions and 1 nursing director, although that nursing director is very much a working manager. And currently, by the way, on those 5, we have 1 on maternity leave and 1 vacancy. So, and since we were already overwhelmed and now we're trying to plan for vaccine arriving, I just want you to be aware we may be cutting back on some services. We're even in conversation with the state on what to do if we reach a point to scale back on our mandated services. We've never done that before. We're looking into asking for surge staffing from the state, and you can ask, but that doesn't mean it'll be available and you can receive it. So I just wanted to even mention, even in environmental health, we hope we can keep up with the great turnaround time as we always have. And I say this because we're even calling on environmental health staff to help in creative ways on the clinical side. And one is our upcoming move. They're helping pack the entire agency. And don't get me wrong, we totally support the move and when it is happening. We've blocked our patient schedules. We need to move forward at that time. It's a good time for us, even though the vaccine's coming. So the only ask I really have of you and why I'm saying all this is that if you get any complaints about any of our services at the health department, please remember this. We're doing the best we can and trying very hard to maintain morale. and we're very close to the finish line, but please bear with us for not continuing to be the overachievers. We really are at this time. We have a lot of type A people over here, and we like to go above and beyond. And right now our management team is saying, our phrase right now is let it go. And we don't burst into song like Frozen, but we just have to put things in priority and maintain our staff morale. So I just wanted to share that with you, and I'll be happy to take any questions.
Shelley, I'll go first. This is Brian. Just wanted to say how much we appreciate the work that you and your staff are doing. And I can only begin to imagine the overwhelming feeling that you're facing. And just know that you have our full support. And we can't say that enough or in strong enough ways to convey how much we truly appreciate and support what y'all are doing. Because you are the frontline defense right now, and it's very much appreciated. Also, I just wanted to say, for the benefit, we do have 2 new board members that are with us. That I know Mark has been a commissioner before, but he's not been a commissioner since we started into the pandemic, and this is all new to Tom as well. And just wanted to recognize that we are still in a local state of emergency declaration. That happened back, what, April? March, end of March. I signed the papers to declare a local state of emergency, and that has remained in effect. We have never lifted that. So just to make you aware of that, that's where we're at. And that gives us some flexibility in able to do some of the things that we need to do during a crisis situation. And as it's been stated, you know, a lot of people think things are getting back to business as usual, but it's not. And so we have to keep that in mind, that we are still in the middle of a pandemic, even though it looks like Christmas outside or whatever else is going on in your life. It really is a serious time, and it requires us to think about, as Shelley has said, how we interact with others. So we are in that state of emergency, and that gives our staff and those at the health department the ability to do some things that they couldn't do in normal times. Are there other questions for Shelley that the board members would like to ask? Commissioner Deeks, I'll recognize you next.
Ms. Caraway,
Yes, sir.
thank you so much for doing this tonight. All that y'all done, we'll never be able to thank you enough. And we'll never really know all that y'all done. And when I sit here for the last 15 minutes and listen to your report, we get more out of that report than we do from literally from the president all the way down through our government. It's just awesome, all the information you have. Thank you.
Well, thank you.
Commissioner Woody?
Yes, Ms. Caraway, thank you again, and your staff. I know that you communicate that to them, how much we do appreciate them going above and beyond. As far as the vacancy for that nurse, is it that we don't have people applying right now, or do you think that there is concern because of COVID and the risk that that position would entail?
I think it's a little bit of both. We actually have had a bit of turnover, but actually not too long ago, we had 2 nursing positions open. We filled both of them. And then one of those people, it was just not for her. Yeah. And we have had people leave even in other parts of our health department. And I will say it's often due to money, and our nurses really, aren't paid as well as when we have a real problem having a huge competitor being the Cherokee Indian Hospital that we could never compete with their rate of pay. And those openings don't come open that often, but when they do, it's pretty luring. And then right now, it would be very, very difficult for us to hire on, say, a new grad, even though they're out there because we have Western here in our backyard. But right now, what a public health nurse has to go through to even become a nurse, we don't have time to train. We don't have time to do that. So It's been a little bit of an issue. Money's one thing, but it also does have to do with who wants to come to public health right now. We don't pay as well, and we're really a lot of work.
Well, and I realize that when these vaccinations come and there are lots of doses and people have to come twice, that's going to put that much more responsibility. So I know that Commissioner Matt Mahan said this, but you have our full support. And if other services have to be put on delay for a while to serve the community with these doses, we certainly will understand that.
Thank you so much for that. And I would like to add, just to give you a little bit of comfort, even though, I just said this is overwhelming, I will say that we are all so blessed to be in Jackson County because this is truly a community. And at the level of healthcare, we have such great partnerships with the hospital, with our community college and our public school system, and our healthcare providers as well, so that we're in constant communication. And we thought we were going to be the main COVID-19 testers too at the health department, because that happens in many counties. Yet no, our urgent cares and our hospital and everybody stepped up, and we at the health department, our tiny little health department, we haven't had to do, we do testing, but we don't do it to the volume we thought. And we're kind of hoping that might play out with the vaccine as well. The hospital has said they'll do anything they can to help. I mean, for example, in testing, they ramped up a COVID response team, and they go to outbreaks and help us. So even though I say we're overwhelmed, and we definitely are, and we're overworked, having to work for many more months, probably 7 days a week, but we have so much support, and I'm hoping it will still turn out that maybe we won't be the primary mass vaccinators. So stay tuned. And we are going to look into surge staff, which means that comes from the state. I don't believe there's a charge or anything. And so we're looking into all the creative ways we can get volunteers, that, retired nurses. So stay tuned. I'll keep you posted.
Ms. Caraway, this is Brian again. What about, are there any discussions from the state level about mass inoculation, as far as using National Guard or other agencies to try to set up areas to administer the vaccine in large quantities? Absolutely. We've had our preparedness folks all talking. We're talking about everything. We're talking about putting up pods, and we're talking about every way we can in every county in the state. So yes, thank you for asking that. But yes, all those conversations are happening now, because it's going to be tough for everybody. For sure. Other questions about COVID-19? All right, I'll start with Commissioner.
I just had one here.
Let me go to Commissioner Strickland next.
Yeah.
That's all right.
No.
I was just wondering, is it going to be mandatory?
Oh, no, that will never happen.
Okay.
Yeah, even as a matter of fact, I found an interesting thing. Now, I read it in an article, but I believe it's true that when a vaccine is being distributed through an emergency use authorization, no one can mandate it. It's only when it's FDA approved, like the flu shots at the hospital, they can mandate their workers. But this will not be mandated. And we did do a survey. We wanted to know, I wonder how many people want it here in Jackson County. And it was very pleasantly surprised. I won't take the time to go into all the exact statistics, but it was interesting how most people want it. Not all of them want it the first go round, but most people say, if I can be proven that it's safe and effective, yes, I'll take it.
Woody?
You mentioned first, and I wrote this down, 1,500 deaths for flu over the last 15 years. What was the number that you gave us before that from this current COVID deaths? Yes, and I don't have the exact number in front of me. I can look it up real fast. But for COVID deaths, which means that's just since January. Right. So let's say in 11 months, we've had over 5,000 deaths in 11 months. In 11 months. Okay, thank you.
Commissioner Jones?
I just want to thank you and what your department is doing, Ms. Caraway. This might be a foolish question, but is the county assisting in helping you all move to other locations? Oh, yeah. Yes, sir.
Absolutely. Absolutely.
It's a team effort, Commissioner Jones. We'll have everything from health department staff to maintenance staff to IT staff. It's a large endeavor that includes multiple departments in the move. And just so everybody knows that to plan a move like this, you can't just all of a sudden decide that you're going to move in a week. You really have to make the decision to move approximately 4 to 6 weeks prior to the actual move itself. And then that way you can actually get IT moved, you can get state moved, you can line everything up. So as Ms. Caraway was saying, the health department staff does have a lot of other duties at this point. The reality is the reason we really need to try to push forward with this move is there's more pieces that go beyond just one department staff. And right now it's all lined up, it's all scheduled, and it's ready to move. And it'll be some disruption and to move like we're talking about. This is your second move now, I guess, Shelley, in the last 2 years, because remember, they had to move into their location now. So fortunately, you got a little bit of practice there. And
Absolutely.
and so with this move, maybe with the first practice, we'll actually do it even better in this move. But it will be a team effort to get them moved. Thank you.
And the other,
Go ahead, Shelley.
well, I was going to say the other magical part of this is that we moved all of our stuff here last time. And now we're going to be moving some of our stuff, but we're going to new furniture. So that's a different story. You kind of walk in with your toothbrush and say, where do I sit? It's pretty good.
It is a smaller endeavor than the first one.
Other questions from commissioners?
Is there anything else that you need us to do to support your efforts, besides being examples ourselves of wearing masks and distancing and?
Yeah, I would say just be advocates for that of please, everybody hang in there for a little longer. It's actually more important now than it was in the summer because of what I was talking about, transmission. And so just asking people, hang in there, hang in there. We're almost there.
All right, I think we're ready to segue into the next topic.
Okay.
Did you have some comments before?
I just ultimately just wanted to predicate this a little bit. This is something that I had requested Ms. Caraway to come and present and discuss with the board. And it's in regards to a resolution declaring racism a public health crisis. And what I'd asked Ms. Caraway to do is to come discuss with the board, talk about the thoughts of the health department board who passed this resolution. And ultimately what I mentioned to Ms. Caraway is this could be a segue in regards to how and if county can be a partner with the health board in regards to these issues. And so I think today's intent is just basically to educate the board about the resolution itself and what the intent was from the health department board, and then just open the door for future discussions about where the county and county commissioners and the health board can partner in dealing with some of these issues. So having said that, I'll turn it back over to Ms. Caraway.
Thank you very much. And thanks for this opportunity. We're pretty excited about sharing this. And as you all know, and as I just discussed, we've not just been dealing with the pandemic in this country and the world and at the health department. Another issue that's really been in the spotlight has been racism and the lack of racial equality. Now, cultural diversity has kind of been addressed in our past in some ways, mostly in things like employment policies, but diversity approaches just haven't been doing the job. And a lot of us just really don't know what to do about it. So at our health department, we do see every day the impacts of racism because it results in health disparities, and we collect that data all the time. We're always here at our health department trying to think of ways to address these issues for our patients and clients. And we work hard to make sure we're serving everybody, not just with compassion, but with equity. But the recent spotlight on the brutal realities of racism, we realized we might need to take a little more assertive approach even in our own house. So we at the health department, we have a diversity action plan for our agency, but again, it's about recruitment and retention of a diverse representation of our population. So, and I actually can say it's worked at Jackson County Health Department. We have a racially diverse staff, but that's just one step in simply having representation. And yes, we have annual trainings on diversity for all of our staff, but we know there's more to it than that. And we realized with all this spotlight that we've never really done the hard work of having conversations and discussions about racism or racial injustice. So we sent an invitation out to all of our staff to just say, let's just come together as a group and just open up the discussion. And our first meeting was June 12th. And as I mentioned, we have representatives from many backgrounds on our staff. So we were really hoping for some good open dialogue, and we were happy it happened. It became pretty obvious early on that we were not gonna just pay lip service to this and just check a box and say we did this. There were personal stories shared, articles, resources, and many of us even joined this online 21-day racial equity habit building challenge. Boy, that was a tough one. I will say I learned a lot, but we added a new section to our website called Health Equity Resources. We brought back a modified version of we have always had an employee feedback form, but we wanted to allow anonymous input from our staff on that issue as well. But we really set a goal to work harder to find ways to get more impactful feedback from our clients and patients and staff as to whether we're truly meeting their needs. But to get to the good part, the group also said, hey, we need to make a real visible statement on where our organization stands. And someone brought up that other counties, and I think a couple of municipalities, had proclaimed racism as a public health crisis. So we did some research, and that became our charge. And after several versions and borrowing from others, we developed the Jackson County Board of Health resolution declaring racism as a public health crisis. And in the document, we have the definitions of public health and of racism, and kind of talked about the impact of racism, especially on health. And we have statistics for North Carolina and for Jackson County on those health disparities that really can be linked to racism. And I see you have the copy of that. I'd love it if you'd scroll down to the very end where the Jackson County Board of Health affirms the last 6 bullet points right there, right up above. So it states that the board, number 1, recognizes racism as a public health crisis. 2, will treat racism with urgency and funding, but I want you to know there's no specific funding identified or requested at this point. They just want to say, if we need to go after a grant, they support it. The 3rd one is supports the health department in efforts to educate our community. 4, collaborates to identify activities to ensure anti-racism within our agency. 5, continues alliances with community partners on this effort. And 6, support the health department in any internal policies and procedures that need to happen to ensure racial equality. So we presented this at our October Board of Health meeting, and it passed unanimously. And so again, as Mr. Adams said, we're kind of bringing this before the Board of Commissioners in part to let you know what the Board of Health adopted, but more importantly, to ask the Board of Commissioners to partner with us in this endeavor in any way you see fit. And I did want to add, after this was announced in the press that this had passed, we received a lot of feedback. And since passing the resolution, we have received endorsements on the declaration of racism as a public health crisis from our local NAACP, from Reconcile Silva, and from Vecino's Farm Worker Health Program. So there's a lot of folks out there that would support this effort in anything we do, the committee we might form. So again, I leave you with the request to consider partnering with the Board of Health in recognizing and addressing this important issue.
Ms. Caraway, this is Brian again. I know I read through the resolution and I looked at the, I think there's listed at the end of the resolution itself, 12 references. And the thing that I wanted to point out and make a comment about was that this is more than just someone's personal belief. This is more than just someone thinking that this may or may not be the case, but a lot of the facts that are stated within the context of this resolution come from studies that have been conducted through various institutes and centers. And it's pretty impressive. And I appreciate the fact that y'all did such a thorough job at listing these references so that we can go and take a look at this supporting documents as to where these thoughts and these points and facts come from. Also, I know not too long ago, I don't remember the exact time frame, but I attended a series of meetings in which we had and Heather, I'll ask Heather to help me remember, but I remember attending a series of meetings and then a public screening of a film through Awake, which talked about ACEs scores. Resilience, thank you. I knew I could not remember that on my own. The name of the film was Resilience. And while it didn't per se talk about racism in its entirety, or that wasn't the theme, it was a component. It was a part of this whole concept. And I was just very moved by what I saw in that film and those studies. And it talks about, economic disparity and domestic violence in homes and yada, yada. I mean, the list just goes on. All these things compounded that kids especially are forced sometimes to have to witness. And those traumatic events in their lives shape who they become, but it also impacts their health. We all know that there's that terminology or phrase, worry yourself to death. Stress has impact on your health. I mean, there's no two ways about it. I mean, that's a fact. So I do appreciate the work that's gone into this document. I appreciate the intent of trying to raise awareness and to document that it is a problem and that we need to recognize for what it is. Other comments from board members? Mr. Woody has comments or questions.
Yes, I have the privilege of serving on the Board of Health, and one of the things that I think would be helpful for us to remember is that the people on the Board of Health, we have health professionals, doctor, dentist, optometrist, pharmacist, engineer, and then we have racial and ethnic diversity on that board as well. And the fact that this was passed unanimously, I think speaks highly of these people's personal involvement with this issue in Jackson County. And these are not health department employees, but they are health professionals. And I think COVID-19 has also shown that there is unfortunately ethnic impact that shows that certain groups are more vulnerable to COVID-19. And one of those that impacts us directly here in Jackson County is the Native American population. And I think we have to be very cognizant of that. I know you all are at the health department, and that we be very thoughtful and sensitive in making sure that we address all those barriers. And that's what really this is about, addressing any barriers for any of our citizens to get the health care they need.
Other comments or questions? Like I said, this is just an opportunity for us to see this for the first time and to start a conversation. Mrs. Caraway, I'll turn it back over to you.
That's all I had, I believe.
Okay. Well, we thank you very much for all that you're doing. Keep up the good work.
Thank you for your support.
Okay, I think, Mr. Adams, you wanted to shift the agenda around just a little.
Yes, sir. If I could, I would go ahead, request to go ahead and talk about the cashier sidewalk policy. We do have staff here to discuss this with the board, if that's agreeable with the board.
Yeah. You may object to us changing that.
No.
We don't want to sit around and listen till 5 o'clock to posting. Been done by 4:45.
So, ultimately, what I've included in your packets is an email from Don Yaley, an engineer and cashiers that works for the group called Vision Cashiers, that ultimately is looking to go through and help fundraise and design better walkways and pathways through the cashiers community. Just a reminder for the new board members, they had approached, this group had approached the previous board to come and discuss the build out of sidewalks in the cashiers community. Now, just to give a little bit of background on this, we currently do have zoning ordinances in that community that basically what it requires when you build out certain commercial projects, that you're required to actually build out public walkways or sidewalks in front of your business. It's for this particular ordinance, and Mike, I'll maybe turn over to you that when a commercial entity is required to build that out, what happens to that sidewalk?
Sure. So NCDOT does not maintain sidewalk segments. Most usually when we understand that's changing a little bit, we're still getting some clarification on that policy. So there might be some instances where they might start doing that, but up until recently, in all cases, they maintain the travelway and the sidewalk segments that they're built. They require a responsible governmental entity to maintain those sidewalks in perpetuity. So what happens, and prior to us including a provision in our ordinances, starting in roughly about 2015, when we started upfitting our ordinances to include required sidewalk segments. The county had worked with DOT on a project-by-project basis to build sidewalks in certain areas of the county that were high traffic areas. That were also presenting some issues with safety, public safety. We did that. We started requiring sidewalks to be built out in our commercial areas in our zone districts to help provide better pedestrian infrastructure. And so what happens is you as a developer have to build that sidewalk to NCDOT's standards that they have. And then what they do is the DOT, as the county and the property owner, enter into what's called a three-party encroachment agreement. That means that the property owner realizes that this is going to be a public sidewalk. DOT is recognizing that it's going to be within their maintained limits. And the county is saying that upon, certification, we'll take over and maintain those sidewalks roughly. That would probably give you a better explanation. That's the rough go of it. We sign that document. Once it's completed, then the county takes over maintenance responsibility for those sidewalks to make sure that there are travelways through on these corridors. In the Cashers area, in 2017, I believe, John, is when the Cashers ordinance was changed for that requirement. If you were going to build a new or have a new development or redevelop a project more than 50% of its value, so you're going to upfit your property or add additional buildings or whatnot, whatever, it would be a trigger to having to go back and retrofit the property with sidewalk. And over time in our jurisdiction, we've seen that be fairly successful at putting in segments. However, it's kind of more of a marathon than a sprint. Not everybody builds along the same time, not everybody upfits. So Vision Captures came to us and asked us, well, if we're willing to work with the community and property owners and raise some money to put these in, would the county continue to sign third-party encroachment agreements outside of the ordinance structure? In 2019, that was when they approached the county, and the county said, we'll look at it phase by phase, and that's where we are is at phase one. And they did some work in phase one. They haven't completed all of what they thought they could. And now I think, John, just want to go ahead on into it.
Well, hang on one second, folks. So I think it's key to understand the reason I wanted to point it out. I know we have existing board members who have this history, but I'm trying to also give history to the new board members. It's important to note a couple of things. One is it's not really standard business for counties to be in the sidewalk business. That generally is a municipal function. Okay? But Jackson County, we operate a little bit different because of our zone districts. And because of that, with our zone districts, you also have the 441 zone there. So Ashers is not unique into this conversation. We also have this in the Colowee area, and then the 441 district area down the Quality. So this community has chosen to go through, when they zone the areas, this community has chosen to proceed forward and take ownership of sidewalk with the understanding that that just makes betterment of the community, that you allow for the build out of walkable ways within the community. And so it's important to understand that somewhat with background before we jump into what vision cashers ask us. Because when vision cashers come and ask the board to take ownership or responsibility for maintenance for these sidewalks that they're going to build out, what they were really asking us to do is to do what we already planned on doing within our ordinances themselves. And so they're just out fundraising and doing the design and engineering on their own, and they're speeding up the process. Now, also what's important in this conversation that we're eventually going to get into is public right-of-way. And the reason, Mark, you and I were talking about just a little bit before the meeting, this is really going to play into John Genowinski, who with the planning department here, his recommendation when we start talking about phase 2, about what is recommended by staff, because our current ordinance really applies to public right-of-way areas and things of that nature. And so I just wanted to give a little bit of context there, because ultimately, if you go down and show, and I'm not going to read verbatim, what you have here is the email from Mr. Gailey talking about phase 1, and then in the second paragraph, he's talking about trying to expand that to a phase 2. And ultimately, he has specific areas that they're trying to work on immediately, but then they're also trying to just create a phase 2 general description so that they don't have to keep coming back per sidewalk. So that's really what I'm seeing here in these first paragraphs. So what I'm going to do is jump down a little bit here, and this is where, so backing up to what Mr. Poston was saying, in 2019, Jackson County agreed to proceed forward with Vision Caster's request under a phase 1 loop. And so, John or Mike, would y'all want to sort of describe what phase 1 is?
Phase 1 loop is Frank Allen Road, that wraps all the way around Highway 64 west, and then back down on 107 here. Village Green, basically the community hub, New Pastures is here, the rec center, apartment center, boys, girls club. So that's kind of the loop, which makes sense because the post office is in that area, so it makes a lot of sense for that loop to be closed, the pedestrian to be there, just because the activity that's ongoing in that area. So that was the first phase. That was really a lot of conversation happened in there. We'll get to another map here in a second. But you can see on this map the gray areas on the sidewalk sections that have been built, and then there are some sections that are under design.
So in Mr. Gailey's request, he's asking that phase 2 be expanded out to here. Okay, and we're going to get to better maps. This is Mr. Gailey's map here. And so if we zone down, this is the what is that? The village. What's that technically zoned area?
The pink area is, there's 2 districts in the Castor jurisdiction. The dark red is the general commercial district, zone district. The light pink that you see here is the Texas Commercial Village District, which is more around the Castor.
So
What is the dotted line?
The dotted line is just the inset of the next.
Correct.
the next.
That's 107 going back. 107 is
That's going back to that. So the reason I want to point out to Gailey, his request is to really include this whole white pink area. But now what I'm going to do is go down to the next map and just turn it over to staff for them to explain what's being recommended to be approved to go into a phase 2 and why it's being recommended.
You move just a little bit. The first map that we were looking at really included phase 1
and phase two, which are these two areas, were basically the village center district. And it went out, it spread out into these rural areas and public road and driveways, which is not really what our ordinance speaks to. It speaks to public corridors. So the map that I produced in here, this red line is basically that phase line. So anywhere that there is a public roadway, is really what we would be focusing on and administering the ordinance that way, specifically for sidewalk construction. And my legend is the green, the dark green that you see is sidewalk that's constructed. The blue is what is in design, and the yellow would be future sidewalks.
So the green's already been done.
That's correct.
Okay, not much, huh?
So you got here, this section, down here, we have redevelopment that will be built here. And this section, Frank Allen Road from the library all the way up to schools.
And so what's actually
Well, that's
speeding this up
Yeah.
is that show them the sidewalk that they're trying to do immediately. It's somewhere from here to here, right, or something like that.
It's right here.
It's right there.
Drops out there. There is a little section there, but they want.
That's what I mean.
There is some sections up here.
They've got that house.
Well, it's extending it down east on
Oh, okay.
64.
Is that-
One piece.
There is a section here already for all the US gap, and that's where the.
Gail and I went there to, where you got the area.
What is that in front of?
There-
What's behind that?
So maybe the Bucks Coffee Shop area, Landmark Realty is this, it's the parking lot right here. That building has books in it, the coffee shop.
Yeah, I don't get up to Cashman very often, no.
Gail and I went there with that, the arrow is. They was complaining about, this, that, well, put in there, your ears, they're gonna have to fix it. That's the track, the track, see, it's like a shortcut, going down that,
Through the parking
going down
lot,
that wall.
Well, they call it, you can cut through that.
right
parking
through
lot.
like the parking lot.
You can bypass the light, go through that parking lot.
Yes.
I think that.
Dangerous.
Yeah, and I think in my talk to DFC about that very issue, I think that what could happen is if the new sidewalk segment gets put in there, it's going to define your driveway because that's how you're gonna have to put so it's going to provide, I think, less opportunity for folks to make a quick shoot through. It may not prevent everyone from doing it, but when DOT comes in and John contests this, because I have a lot of sidewalks or put them together, they're gonna require kind of a 90-degree driveway, so it's not gonna be this open parking lot that you can just kind of cut through. You're gonna have to kind of slow down, make that turn, and come back out on the other side. So
Okay.
it may not solve all the problem, but it may cut down on that issue a little bit.
So, somewhat to recap, their immediate need was they were wanting to build that out quickly. Their request was to go ahead and phase one was right in here, go ahead and include all of this area here for the next approval. Now, remember, when you approve, you're not approving all sidewalks to be built out. You're approving that the county manager can sign off on these sidewalks. And I rely on staff to make recommendations as far as whether or not they're designed correctly and things of that nature. And so the request is to extend phase two out all the way out into these rural areas. And staff is recommending that if we wish to go beyond phase one, then your real options would be to just approve this initial request, or to, if you go beyond that request right here, then to just limit it to the yellow areas that we're looking at here. And I know John is defining it by the dotted line. I say the yellow area because there's this little no man's land out here that I would just go ahead and include into this conversation that goes outside of that dotted line. That wouldn't hurt anything, would it? I mean, that's planned to be a future sidewalk there, correct?
Yeah.
Okay, and that actually technically falls out of phase one and phase two.
Yeah, it just happens to be in the other zone district.
So if the board is inclined to authorize the county manager to sign off on additional sidewalks beyond phase one, then the recommendation would be to limit it, my authority, to this yellow area on John's list. That's the correct statement. I mean,
Yeah, and I think what that does is it's not like there's, they do have something called the ramble up there, which would lighten more to a greenway and trail system that would connect. But I think what's consistent with all of our planning documents, including the small area planners, we expect there to be some, we would like to see sidewalk connectivity and or pedestrian connectivity along our corridors, especially 74, 107, Frank Allen Road. And I think that's what John is showing basically here. Once you get out here, you don't have a lot of state maintained roads anyway. They're on private driveways that go to properties back in those areas. So I think that's why we looked at along where you're most likely to see sidewalks.
So then on phase one, where the blue lines are, you're talking about just forgetting those for now?
No, actually, I think, John, on your map, blue is under design, correct? So this piece of property, they are redeveloping that piece of property, so our ordinance requires that they also include sidewalks. There's gonna be about 500 feet of sidewalk built.
Also right here.
And then also right here, there's been some developments here that also require the sidewalk. So, and this gets back to, well, these are kind of two different parts of the same conversation. One is you do it as you build it, the developer's responsible. The other one is a more proactive approach that a community group would like to see this done just a little bit quicker. So they're engaging property owners to say, hey, you're not triggering the ordinance, but we'd really like you to go ahead and agree to put the sidewalk in, and we'll help do that. And that's what Vision Council is hoping to accomplish, thus speeding up the time frame that it would take to have a connected pedestrian network through the crossroads area.
All right. Any, because 64 is a U.S. Federal highway, any regulations that need to be looked at?
Just standard DOT, because even though it's U.S. highway, DOT is responsible for maintaining and the upkeep and maintenance. And so it's just standard, they review, John reviews it, from the county standpoint that it meets ordinance standards. But really, they also, he works with the staff over at NCDOT to make sure that we're all on the same page about what that means. In this section, Don, are they doing curb and gutter along or?
There is going to be a difference depending on the road section and the posted speed limit and the design speed of the road. We do have sections where new sidewalk is constructed, there's curb and gutter, the DOT will require that. 64 has that. At the end of Frank Allen Road, right around where the ERP sales lot is, that is all curb and gutter around that section right there. So there are sections, depends on what their road section is calling for drainage wise, whether it's swell or where it's something within that right of way. I think that way.
So this falls within your recommendations of the small area plan protection.
Correct, and like I said, I think a good way to look at this, what Vision Council is trying to do is just, accelerate the time frame in which these get put in place. If we were to allow this to happen naturally, we've already got, the board's already approved a resolution that allows county to sign off on them when they happen during the zoning ordinance rules. So these are places that we would require if they came in and asked for a development permit. We require sidewalk anyway, so these are going to be the same areas.
Thank you.
And another key component here, just so everybody understands, this is a repeatable process in the other zoning area. Meaning if a organized community group wanted to speed up the build out of sidewalks in Coley or speed up the sidewalks in the 441 corridor, then they can copy this process. They can get that, Yaley is an engineer, it's a group of people, they're fundraising the money to build out the sidewalks. Either way, from the county's perspective, what we're going to do is just take it on and maintain it after it's been built out.
And I also mentioned just in a bigger picture, the county is currently in the middle of developing a comprehensive pedestrian plan countywide that will help us manage through policy and procedure sidewalks in total, and how we handle that is, as I mentioned earlier, sidewalk maintenance is not a typical county responsibility that you'll see, and we're one of the few counties that participate in this, and so we're kind of working through how this works in totality in the pedestrian plan, we should have in front of you shortly within the next few months to better define how this all works together, not just after, but how it works wide.
I just want to mention, this is not really a cosmetic component, it's a safety, pedestrian safety issue in that community.
Any other questions? I'll do all that.
What's the next step for us?
So the request, if the board wishes to proceed forward, I would request to see if there's a consensus to proceed forward. If so, then this issue would be put onto the next agenda. We would utilize this map, John's, Mr. Juliski's map, as the basis of approving, basically authorizing the county manager to basically extend and approve all sidewalks that being Asher's built that match up with the yellow here along with them.
Mr. Dees is in approval of adding it to the agenda. Mr. Woody, would you concur?
Yes.
No concern.
I'm sorry, what is that gonna cost?
This doesn't cost us anything. Now, the cost for us is what Mr. Poster was saying is long-term maintenance.
Yeah, to maintain.
Now, that one right there, I don't have, we are literally putting this together. Once we pull a system together, we will eventually have a cost of replacement.
Is there grass in there? Is there grass median or is it just all concrete?
It really just depends on the section and how DOT out. John, you want to go ahead?
And sometimes if you have a curb gutter section, there's two ways to go about it. If there's a swell section between the road and the sidewalk, you can be pushed off the road, and it would be obviously a shade area. The typical section that DOT has for the sidewalk, you do have curb and gutter section, and then a sidewalk right behind that, or sometimes you have a curb and gutter section, a 2-foot correction zone, if somebody got off the road.
Right.
They wouldn't get the sidewalk, the road and the sidewalk. So it depends again on the right of way width and what they have, and they're pulling that tool out of the tool.
So, but today along, like for instance, along 64, they're doing just straight curb and gutter with a correction zone or without.
So that's that new section that's up there on 64 right now is a curb and gutter.
Yeah, because concrete's a lot cheaper to maintain than grass.
Sure.
Definitely. That or beds with flowering trees or what have you.
So what we're seeing is obviously the sidewalk, curb and gutter sidewalk, and then it's basically property ownership behind that.
I see. Okay.
So long term, there will be a problem. Eventually, it will lead over to becoming a maintenance issue.
Right.
Once right now it's very minimal, just so you know, in all the areas where we technically are responsible for maintaining. And it really, it's gonna have to get built out before I could truly start telling you what the long-term maintenance costs are gonna be.
Right.
I think ultimately, the board, this previous board and this board is moving forward with the understanding that eventually that cost plan will have to come back to you. I can tell you, in our conversations being held, right now, I see long-term maintenance of these areas are going to be very similar to the 107 sidewalks that are based on the 107 strip. And so we've had conversations with Silva about that. They don't do like smooth removal, things of that nature. They're not going and putting salt all the way from downtown to Smoky Mountain Elementary School. So we would end up doing very similar maintenance like that, ultimately not necessarily maintaining it like we would a sidewalk that's outside of the facility here where we have to man it, put salt on it every day and things like that.
And just for I know Commissioner Scribbling is new to this, and maybe Commissioner Jones to this conversation, but we did also talk about at some point developing a schedule, maintenance schedule, and what those anticipated costs might look like and generate some kind of forecast, because it is a real number.
Right.
And it factors into future budgets, and especially when you get into replacement costs and those kind of things. So there is a model in place that they're working to produce those numbers, but we won't know until we get there. So at this point, do you have any other questions, Commissioner?
No, I'm good.
Are you comfortable with this being on the agenda for the next voting session?
Yeah.
All right. Well, hearing that, then, Mr. Adams, go ahead.
Thank you.
Thank y'all.
Thank you. Sir, are we good or do we need to take a vote?
Anybody need a break? All right, let's continue on.
Okay. So we'll move back, and the next item of discussion is in regards to some mid-year proposals that are being brought to the board. You do have under attachment A summary letter from me. Ultimately, what I'm attempting to do in this summary letter is to just provide a little historical context to this discussion. So as you can see, I'll start off, as everyone is aware, our community, along with the rest of the nation, has been battling COVID-19 pandemic for the last year. Obviously, we just spent the first half of this meeting discussing that. You know, back when this board, the previous board was reviewing the budget, there were unknown potential expenses and revenue issues when the board was considering the budget and when I was presenting the budget to the commissioners for the 2021 budget year. My recommended budget and eventually approved budget by the board was conservative regarding the listed areas there. It was conservative for sales tax revenues. We actually reduced budgeted sales tax revenues 2% below the previous year's budgeted revenues. The cost of living adjustment that was being discussed that was previously not necessarily approved, but looked at favorably in the February work session of the board was actually delayed and not implemented. The current expense funding to the public schools was held level. The current expense funding to the libraries was held level, and the expense to operating expense to Southwestern Community College was held level. The budget message to the board that's dated May 26, 2020 recommended that these issues be revisited in January 2021 once a better understanding of our sales tax impact were known. There's enough information now. You wonder why in December. There's enough information now for this board to start considering this issue and making some decisions. So it is proposed that the board provide a COLA to all county, a cost of living adjustment to all county employees. It's proposed that a one-time bonus to all public school certified teachers and other staff be provided. In addition to this one-time bonus, it's recommended that the Board of Education develop a new teacher supplement program to be presented to the Board of Commissioners during the next fiscal 21-22 budget cycle. It's also proposed to provide an additional 2% funding increase to the libraries and an additional 2% funding increase to Southwestern Community College. Since these proposals, these four proposals we're discussing here, since they are for ongoing expenses that will be here this year, next year, and the year after, and so forth, it's being recommended that these four issues be funded through an increased sales tax revenue. And we're going to discuss these details here in a little bit. It's also proposed that the board consider providing a one-time bonus to full-time and permanent part-time county employees. And I'd like to say, and when people read this, I'd love for them always to focus on this last paragraph a little bit. The intent of these proposals to do a few things, a couple things. One is to follow through with previous commitments, but also an attempt to recognize and reward our employees for their work during these extraordinary times. The pandemic has caused county operations to transform and adapt in order to continue to provide safe and effective services. This includes both direct county operations and also indirect. Indirect meaning school systems, community college, things of that nature. You know, the continuous delivery of service, I believe, to our citizens will continue. I believe our employees will continue to do so. I'm sure that they will do this. So I'm truly appreciative, and I know this board is of all the service that our employees have provided to the community. So just jumping into the details, we'll jump to attachment 2A. So again, the way I'm dividing this conversation up, even though I split it out on tabs, when I would provide this information, I would do it all under one cover letter. But going to 2A, this is the mid-year funding summary explanation. this is the funding recommendations that requires ongoing revenues in order to fund. So you can see the 2% cost of living adjustment being recommended to begin on December 21st, 2020. The pay date, as you can see, the employee first see it would be January 8th. 6 months cost would be $201,084.50. But we also need to look at it from an annual perspective because we have to allocate, be prepared to allocate an annual amount of money to continue these funds. As you can see on the public school side, the proposal of doing a $500 bonus for every certified teacher and non-certified employee to the school systems would cost $359,000. Now you can see that would cost $359 in 6 months because the proposal is to allocate that amount of money all at once. But that would also potentially be an ongoing expense if the school board can come back and provide and give you a recommended updated teacher supplement program that you're willing to move forward with. This allocation would be in lieu of the 2% general increase. And again, that's where I mentioned the Board of Education would develop a new teacher supplement program for next year for this board to review at a later time. We're also looking at a 2% allocation to Fontana Regional Library and a 2% adjustment to the community college. So the 6 months cost that you see there would actually be around $624,202. Just so you know, Darlene just gave me some updated numbers, and so these numbers may be off a few dollars here and there if you choose to move forward with a budget amendment, but they're fairly right on the money. So that you can see if the board chose to move forward with this, this would end up being an annual cost of $825,000. What I try to provide with this information is just justification of what has been occurring with our sales tax. So what I've provided to the board is, and before I jump into this, to let the board know, this is the county portion of our sales tax. Just a reminder, a portion of our sales tax is mandated to go to school systems for capital needs. This does not include those funds. If I included those funds, it would misrepresent how much revenue we would be getting that we could apply to these costs. And so overall, we get more sales tax than what you're seeing here. This is just the county's portion of it. So you can see back in 1920, the county budgeted $9,441,000, $62 for sales tax. But you can see last year, and this is last fiscal year, that we received over $10 million. And then the next run down here, as you can see, this year we budgeted $9,252,000 in sales tax. So what I try to do is just run some summary lines down here. So again, you can see this first line states that in fiscal year 1920, we budgeted $9,441,000 and received $10,048,000. That's 6% above budgeted amounts last year. You can see also Jackson County budget $9,252,000 for this current year, and this was 2% less than last year's budget amount. But it's key, I'm focusing on budget amount, not actual receipts. If you compare this year's budget of $9.2 million, you see on that third sentence, to what we actually received, we're budgeted about 8% less than actual received last year. And then if you jump down to the fifth sentence there, we're currently, or excuse me, the fourth sentence, you can see that currently fiscal year 2021 first quarter overall sales tax, July, August, and September, has averaged about 16.78% increase over last year's actual, not last year's budget, actual. And so going down to the next sentence, we're currently trending around 24, almost 25% above 2021 budget amounts in this first quarter. I mean, and so increasing our budget amounts, if you go back up to our columns here, and you can see we have $9.2 million budgeted. I think I'm showing you here, we're trending much higher than that right now. If we increased our budgeted amount by 7% this year, I just want to show you, you see that 647, and if you scroll back up, We need approximately 624. So basically, if you did a budget amendment this year, not trying to anticipate 25% growth, but just 7%, then obviously that covers the expenses that I'm proposing here. And then next year, it would reflect out to be about a 9%, which ultimately showing you 9% here of $832,000. It would cover the $825,000 necessary to cover this on an annual basis. So my final sentence on this page is that even if we do not continue to trend 24, almost 25% above budget amounts, it's reasonable to believe that 7 to 9% that we have that capacity to proceed through. So obviously, COVID's not over. We may have some issues that we're dealing with. I'm showing you trending the first 3 quarters. Now remember, it does take time for us to see these revenues. So I can only give you the first 3 quarters, but we're almost through our second quarter. So the reality is that I don't think anything has truly changed. Excuse me. I don't think anything has. I'm sorry, I lost. I don't think anything has truly changed when you're sitting here looking at October, November, and December, and we're already through that. So I think you're going to see in the next 3 months of data that comes in, it's still going to trend much higher than last year. So I feel like this is a safe number, even if we did start seeing downtrends, that it's safe to allocate these funding for ongoing.
Okay, let me just clarify and make sure I understood this correctly. And then we'll take additional questions. Because this is really broken down into 2 segments. This is the first segment. And I think just to reiterate what our manager has said and to put this into context, provide some background. When the pandemic hit in March, it was, as Shelley Caraway and others have all said, we really didn't know what was going to happen. And in trying to be prudent, in trying to be wise, in trying to be good stewards of the public's money, we tried to be as conservative as possible. And our staff, when they put together the budget, did so in a way that reflected that real conservative nature. Our partners, the school system, the community college, Fontana Regional Library, all the others understood that and were willing to wait and see how things would come about. It could be worse. It could have been as we sort of forecasted, but thankfully we could all say that things turned out much better. And so the monies that we're talking about here are purely from sales tax revenue increases that we did not anticipate, that went way beyond what we had projected. So these cost of living adjustments, which would normally have occurred for county employees, are going to be able to happen, the COLA, which we held off on. The public school one-time bonus is sort of filling in the gap where we asked them to hold off on the additional funding. The 2% to Fontana, the Southwestern Community College 2% here again are, we delayed taking action on these items in July for the ratification of the budget and said we would come back and revisit it if things look good. So we're just following up on our commitment to where we said we would be at this point. And thankfully, we're in a good position to do so.
Yes.
Is that accurate?
That's absolutely right.
Any other questions about what's being asked? Obviously, we won't vote on this today. This is for us to discuss, but this would be on our agenda at the next meeting.
Yes, Travis. And then I do have the second part.
Correct.
It would be
Mr. Woody, go ahead.
Just after you said that, if we approve it at the next meeting, when would they be able to get the, say the school get the check, or would it be reflected in the next paycheck for these other entities?
So I have had conversations with the school system regarding this, and I believe you, as far as being able to get it out before the holidays.
On the 17th, so we'll be waiting for approval from the commissioners on that Tuesday board meeting. Of course, we have a board meeting that Tuesday night also.
Okay.
And I've prepared our payroll in anticipation to be able to push the button, so we will get it out to our staff on the 17th. So next week. Good.
Well, that's great. And then what about our other staff, and, Jackson County employees, et cetera? Would that go in the next check?
So, you want me to- so I'll jump to that.
Let's,
one.
let's talk about this one next, because
Okay.
you said the cost of living adjustment begins on December 21st, correct?
Correct.
So that would not show up until January. Cost of
Okay.
living.
Cost of living.
Oh,
But we do have another bonus that's gonna be, that's being recommended to go to the employees that we haven't talked
But
about.
these adjustments out of the sales tax, with the exception of the school, everything else is pretty much what happened.
And the only difference here from the discussion we had at budget time versus now is this is actually a really good opportunity to look at teacher supplements and look at that whole program. And this is something that's been discussed with school staff. So instead of looking at a 2% across the board increase for current expense to the schools, this was an opportunity here to allocate some of these revenues to the schools for them to give to their teachers and to their employees to recognize their employees as far as the job that they've been doing during this whole pandemic. And we're going to discuss county employees here next. But that was an opportunity here that I thought that was just a really good opportunity to proceed forward with that. And then when we're also talking about allocating a portion of our future sales tax to this is where we thought it would also be a good opportunity to address an issue that I know several board members have been talking about, they wish they could address, and that was trying to enhance the teacher supplement program. But right now, we just don't have enough details about that to basically say that's absolutely going to happen. That's where I put the challenge back to the Board of Education to come back and present to you a new plan that will be discussed during the budget process. And by setting aside the $359,000 for this conversation, we've already set it aside. Now it's a matter of just everybody coming to an agreement. So that's the only difference from the original discussion. We didn't know that this would be here as far as having the ability to talk about teacher supplement. But if we weren't talking about that, we would be talking about a 2% just across the board increase.
Any other questions about this first wave of the discussion that's coming from the sales tax increase? Okay, Mr. Adams, we'll move to the second component.
So the next item, and you can see is in regards to, if you go back to the summary, what I'm also proposing that the board consider is allocating some of the COVID dollars received to help with us during the pandemic. Just so you know, we did receive these funds and we used these funds to offset our cost for some of our personnel. And so that's why we can sit here and look at these costs and basically say that these costs can be reallocated because they're not committed to anything at this point. And so it is being requested that $100 per month to full-time employees, prorated for part-time employees. And remember, when we say part-time, we mean permanent part-time. We have positions that have set times that are part-time. That they be allocated $100 a month for a 10-month period. And let me tell you how the 10 months was calculated was, as stated earlier, the state of emergency was declared in Jackson County, what did you say, March 16th? March 16th. So if you really go back, even though technically we all know we probably were being impacted by the pandemic a little bit earlier, we really weren't truly reacting to the impact until about March. And from March till now, it's 10 months. And so the reality is we're proposing that we make available $100 per month for full-time and prorated part-time employees for a 10-month period starting from March till now. So if you've been employed since March or prior to March till now, that would be a $1,000 bonus that would come to you as an employee. If you've been here for 3 months, if you just got hired 4 months ago, you still are working for Jackson County. You still are providing good service to our citizens, and you're still having to deal with just the adverse conditions that we're having to deal with because of the pandemic. If you've been here 4 months, you would get $400. It's that simple. It's trying to be fair as we can on that. And ultimately, I'm sorry, it's a pretty good deal. And ultimately, we're just trying to recognize the good work. This is a bonus. This is recognizing that all of our employees, whether it be the health department employees that we were talking about frontline to our janitorial, housekeeping staff, so forth, have been working hard to basically deal and provide great service in these ad hoc communities. And this, to go back to your question, Commissioner Woody, this will be paid on December 18th, if approved by the board.
Yeah, and just to put this into context again, if you remember when the federal government authorized the CARES Act, this money flowed downward. That's how we ended up with this money. And there are limitations on what it can be spent on. We can't take this money and go out and buy all new patrol cars or budget it certain things. I mean, we have to use this on limited things that we are limited on. So, and personnel, as Donna said, is one. So we bought it probably as much hand sanitizer as we can buy. And I think we've got a good stock of that. And I think from what I understand in our meetings, our supplies, all jokes aside, our supplies as far as being prepared for the pandemic response, we have been able to replenish supplies and have extras on hand to meet our needs as this pandemic continues to go forward. So that doesn't jeopardize any of our response.
And if you see, I am recommending, the pandemic is not over. We still have a portion of this money available that we can continue to have these conversations. So I am recommending that we do keep some of this monies available until we get to the end of this. And that we will be in a position to react to buying PPEs and so forth. We do have a stakeholders meeting, once a week, emergency management hospital, things of that nature. And they have said that the PPEs have been taxed here lately, but they are in good supply and we are in position to keep reordering those items.
Any questions about this request?
No, I think it's good. I wish we could give public schools $1,000.
Well, that was coming out of the
Tax.
Well,
Yeah.
and that's an ongoing, and this number is a number that's derived.
Well, I know
also
it's from
because-
COVID, and I
Well,
totally
no, I mean,
understand
it's a
that.
number that's derived that's also going to fall in line with what is needed for us to have a real serious conversation about increasing tax supplement. Here's the difference, okay, between this $1,000 and the $500 going to the teachers and so forth. This is one time for county employees. That's it, one time. What we're talking about for the teachers potentially is going to be from now and ongoing.
Yes, but we're also talking about a 2% adjustment in their salaries that's ongoing.
Talking about county employees?
Yes.
Well, that's something that we had already talked about.
Right, exactly. So I'm just saying, I think
But they're also
still
going to
is.
get,
we're gonna,
but no, the teachers get, and they get their state raises too. Now, I want to make sure we understand that we are doing, this is doing well for the schools. I don't want to get misunderstood here. The school employees get their ongoing raises. The raises that we're saying we're now actually going to do for our employees. But then what we're tacking on top of that is what's going to be ongoing increased supplements that go on forever.
I'm a retired teacher, Don, I understand that. But I also look at this map.
Yep.
And Jackson County is one of the lowest as far as teacher supplement in the state.
Yes.
So I do, I'm just trying to advocate. It's not gonna affect me, but it's gonna affect the future of our children. And I know that there's this other conversation, which we do need to have with our school board later, but I was just thinking, I know the teachers right now are working so hard, all the staff, lunchroom and everybody. And it's COVID related. And I'm just asking if there's a possibility of adding to that. And if not, that's fine. But I would just want to ask that. I mean, I respect Darlene so much, and I know you crunched these numbers.
First of all,
Well, the 500,000 is what you've set aside as remaining to hold to use for potential pandemic expenses going forward. Is that what you're suggesting that we use?
Well, I wondered if we could, I mean, I know it, because the teachers are working under these COVID situations. And maybe that's, I don't know. I'm just asking, and I respect y'all's input as well.
I think it seems pretty balanced, being that they only get the one-time bonus, to where the teachers continue to get their increase yearly. I mean, in the long run, I think it's probably pretty much a wash all the way across. It's like Tom said, they only get it once and that's it. And they don't get it next year for the year after. That's it. One time.
And that 495, I've had a couple idle thoughts. That almost half a $1,000,000. We don't know what's coming down the pike with COVID. We don't know how many needles the health department's going to need. We may have to provide staff to enforce these inoculation vaccine areas. I don't know how much the state's giving in. I'm sure that's been looked at. So not knowing what's coming down the corner, it's better to hold off. And if things continue as they are and the vaccine gets to us in a timely manner and things calm down, we can discuss and revisit some of these funds.
Yeah. Look at that maybe a little later down the road.
Okay.
I agree with that.
The other thing we discussed too is are the volunteers for the fire department commission.
Yeah. They're important too. Very important.
Oh, yeah.
And that would have to come out of the money that you're wanting.
Okay, well, maybe we should do that.
Well, let's do this first.
Okay.
This is what we got planned. We're not prepared to deal with the others.
Oh, okay.
So the question is, are we comfortable moving forward with what's already been worked up in the formulas for next week? I know there's both finance offices with the school system and with the county are awaiting our action officially at the next board meeting to be able to put us in a position to cut these checks. Is this something that we won't feel comfortable to put on the agenda to vote on? Sure.
Yes.
Yes, sir.
Yes.
Woody? Boyce?
Yes.
All right.
Thank you. And I do think, hopefully, this is a package that shows that we are appreciative of the teachers.
Absolutely.
And that we are appreciative of the workers at the schools, and that we are appreciative of our county workers. And that at the end of the day, this is a precedent that hasn't been set either, as far as what you as a board are moving forward to do to try to show appreciation to all of these employees.
Yes.
So I want to go back to that from the positive light. This isn't about how much they get me. It's a step that's been taken that's literally hasn't been taken for teachers in extremely long time. And that this is all positive, this moving forward to what's going to teachers and what can be for teachers and for the workers there. That's going to be now and forever. And then obviously this is all positive about what can go towards county employees of showing appreciation. So thank you.
Mr. Adams, if I made a comment too. Go ahead, Coach. On 2A, the Fontana 23,000 increase and the 2% from Southwestern 41,000. Is that can we structure that or give guidance so that can go to the staff? Or is that just be absorbed in their general budget?
I would, in general terms, I would hope that they can do that. I do know in conversations with them, they're regional. So the reality is for the library, the $23,000, I think would go a long ways locally. And they may have the intention to do this, meaning outside of these conversations, they may have the ability, intention to try to look for the employees. SCC, I think we're going to have to rely on their staff to see what's the best use for the $41,000, because you're talking potentially hundreds of employees that are considered on our main campus. And so hopefully SEC can work something out with their staff and we would leave it to them to use the $41,000 as they deem appropriate. So I think it's hard to say absolute guidance. I think we can encourage them to move forward, and if they can get it to their employees, that's a good thing.
As a trustee at SCC, I'll make a push for that approach. Because that's what the intent of this is.
Well, and I'll just say for the Fontana Regional Library, they did request a 2% raise for their employees that we did not give them out of abundance of caution. So I have a real good sense, like Manager Adams said, that they would use it for that.
Mr. Deep, you had a question?
Yeah, I'd like to, Secretary Buchanan, they're inside, treating everybody the same.
Yes.
This time, this one time, it's probably a great morale. Thank you.
That's all I have. So both of these will be putting on the agenda for
For the agenda for next week. General discussions, do you have anything else, Don?
I do not.
Commissioner Dees, do you have anything to bring up? Okay. Commissioner Wood?
Yes, I participated in the North Carolina Association of County Commissioners annual meeting, legislative goal meetings yesterday and Tuesday. It was June. And one thing I wanted to mention, that if y'all could put this on your calendars, January 14th and 15th is the annual conference, and it's by Zoom, and it will be voting on the legislative goals. And they accepted the goals that we had sent in unanimously without change. So that was real positive. And they feel like from the federal government, they just wanted us to pass this on to people, that they're looking at $908 billion of COVID relief, and this $160 billion would go to the states for local. And we made a request that would come to counties, a good portion of that. You know, last time there was that phrase shall or will, and so anyway, we won't go into that. But they talked about it this way, that before we run out of gas, we need to fill up the tank. And I thought that was a really good visual to think about. If we wait until we run out of gas with helping our citizens and our communities with unemployment issues and some of the economy constraints because of COVID, it'll be too late. And so we need to move ahead with some of this. So that was pretty much just what I wanted to tell you.
Mr. Woody touched on it earlier. Have any of the commissioners talked with the teacher about what they had transitioned from the virtual teaching in class to virtual? I worked with a Western WCU grad math teacher who got a job at the Jackson County school system the last couple of years, and she graduated this summer, and she got her job, and she's teaching math and doing very well. And she works weekends now, 1 or 2 days a week. My point is, hearing her talk about the transition, and one time she said, "I didn't sign up for this. They didn't teach us how to do the virtual training." And from what the teachers have gone through and having to go that extra step and extra effort, and with the technology, which I'm clueless on, I'm commending because I talk to her every weekend about it's just kind of an ongoing story that she's working with, and the training she had to go back and take to do this virtual teaching. So my hats off to the teacher.
Any issues, Mr. Chairman?
Ditto with military. I agree. God bless them.
Yes. And Mr. Buchanan, would you mind expressing to them from the board, all of us, I think, have said that. And I know Brian lives with someone who is also working very hard in the school setting. So if you just express that, we would appreciate that.
I would be happy to. And, you know, many of you have heard me say this before, our community loves its school system. And our teachers feel that every day. They have faced unimaginable challenges this year. But I am unbelievably proud of how hard our teachers, our parents, and our kids have worked to get through this year and be something. I had principal meeting this morning. I mentioned to them from the very beginning, I kept saying that when all this is over, it will be over. We'll look back at this and be very proud of how we conducted ourselves and how we came together to support the kids of our community. And that's just been shown over and over and over from the outpour of the support for our teachers and our kids and our parents. And that extends to the commissioners as well. And this COVID bonus will be extremely well received and people will be very thankful for that. It will go a long way for morale at this mid part of the year. We're halfway through.
Yeah. Commissioner Deeds?
I also read, with the North Carolina Department of Transportation have approved the naming of
Yes.
Dr.
Jerry Wolf.
Dr. Jerry Wolf, great Cherokee Indian Native friend of all of ours. Named the highway from 441 down the gateway to Cherokee. And I really look forward to that happening. They get to do that.
Absolutely, for sure. Do I have a motion then that we adjourn?
So moved.
Second.
All in favor, say aye.
Aye.